I'm sitting here with Dr. Vincent Mack, and Dr. Mack, you've been a dentist for how long now?
I've been in practice since 1987, going on my 27th year.
27th year,
Yeah,
congratulations.
yeah, thank you very much.
So, I know I just had a number of questions, and my curiosity revolves around people who are turning 50 and
Sure.
that last half of life there.
Right, and I happen to be 51, so I'm right there, right with you.
Oh, congratulations.
Yeah.
Welcome to the group here.
Got my AARP card in the mail the other day. Sure.
All right. But I was wondering, just what kind of challenges people 50 years old on up, what are they facing today that they may not have faced in the past? Or, you know, how has oral health changed? What should be more concerned about here in this latter half of life?
Well, obviously I've seen a lot of things practice and change in our practice over the last 20 years plus that I've been doing it. I mean, what we were taught in dental school is completely different than what's in the real world. And I think especially for the people that are over 50, they're keeping their teeth so much longer now that they're being offered other choices for retaining their teeth or to replace their teeth that they've never had ever before, especially with the advent and initiation of dental implants. I mean, it is much more mainstream than ever before. And also the preventative aspect of keeping your teeth from ever losing them in the first place is a huge topic for people in our particular age group.
Okay, so dental implants, I mean, that is usually reserved for people who haven't taken care of their teeth so much up to date, or how does that come into play there? I guess I'm not really familiar with it.
Okay. Well, what an implant is, it's a replacement of a tooth where a metallic root form is placed in the jaw structure. So if you lost a tooth and you needed either a denture or a removable appliance, or if you had bridge work, we're now able to parcel back individual teeth where the teeth are missing and they're anchored solidly to the bone. Well, what's different about that is people no longer need a denture. They no longer need to have fixed bridge work, which is more encompassing and more aggressive, more damaging to the adjacent teeth. Things that I was taught 30 years ago no longer apply in a lot of the everyday cases I do for the average adult. So that's what the implants themselves, and also I think on the preventative aspect of it, it's that we have a much greater grip on what people should be doing to keep their teeth out of trouble in the first place. So we want to keep them also from losing them or having problems with them in the short run.
And so what are some of those recommendations?
Well, you know, we're looking at factual information. A big thing that's kind of, you know, going in the direction of medicine and dentistry is what's called evidence-based science. They're looking at statistical studies, blind studies. They're doing literature searches of actual studies around the world that are validated and truthful in their nature, not necessarily sponsored by a corporate, you know, entity. And they are showing what are the things that actually work for the main population. For example, we know for a fact that people that are at risk of having gum disease, if they get their teeth cleaned more often, maybe 3 times a year, maybe 4 times a year, that linear relationship, we don't know exactly what causes it. Is it the actual professional cleaning, or is it the frequency, or is it the initiation of enthusiasm to just keep their teeth clean? They're keeping their teeth longer with more preventative action. And the evidence-based dentistry shows more frequency of periodontal cleanings makes people healthier in general. Okay, I don't know if that gives you an answer. So.
Okay, now is the last half of your life, and is it your gums are more important, more so comes into play as opposed to the earlier stages?
Absolutely. I think with the advent of some of the dental materials that we can rebuild the tooth, and we can expect it to last easily 15 to 20 years with materials that we're rebuilding it with. Not forever, but you know, 20 years is a long time. When you start getting into your 70s, how long are you going to be around? But the important thing is the bone. If you can maintain the bone level, it's almost the more important commodity than the teeth. Because if you have the bone, if you lose the tooth due to a fracture or some other reason, you can still put an implant back and put a tooth back. So I think really a lot of the emphasis for people in the 50 plus range is to really keep the teeth clean and healthy in order to preserve the bone. And then that's the real gold there that we need to hold on to. In the days of old, when we used to say, let's wait till the teeth are just falling out and then we'll extract them and make you a denture. Now we actually are saying if you're heading in that direction, we don't want to lose all that bone. Let's take the teeth out a little early because your track record is bad, but let's save the bone so that we can do something with it. Once the bone is gone, it's much more difficult to put it back in the oral environment.
And what causes the bone to start deteriorating? Is it just age there?
You know, I've seen most people, if they have reasonable home care, do a pretty good job, but some of it's genetic. I mean, there are reasons that people will lose bone even if they have skills that are unmatched. So there's some genetic potential to lose bone. There are health issues which definitely affect periodontal bone levels, such as diabetes. Diabetes is a kind of an insidious sort of systemic illness that has some complications with it. But the main thrust still in today's world is general wellness, being, hygiene, that if those things are all in a good fashion, then you're going to be able to maximize your own potential and typically keep your teeth and your bone at a safe level.
So when you mention hygiene, so like flossing on
Yes.
the basis that
Yeah.
what
What you do on a daily basis to kind of take care of your teeth, but it also has to, you know, you asked me some questions to kind of think about. It also has to do with nutrition, I think outlook on life, and other activities in your life that all affect that. You know, so for example, if you eat certain foods, some of the research is showing that they have a positive effect on the general wellness of your life. And so I'm not a nutritionalist by any stretch of the imagination, but I do believe that you are what you eat. And certainly eating healthier foods, I think, have a play on your general dental health.
Mm-hmm.
So I think the nutritional aspect is one thing that plays into preserving your teeth. But also lifestyle, being active, absolutely is a key factor, I think, in relieving stress and keeping your immune system jacked up. And also, I think it gives you a better outlook and attitude on things. I think being active is something I always promote.
Mm-hmm. And that even plays into your teeth then, and the bones of your jaw, everything. I mean, wellness plays into just so much of everything.
Absolutely, absolutely. I think that the people that are involved and that are physically active, it doesn't have to be a superstar athlete. You could walk your dog every day, you know, and maybe even go slow. But those people have something to get up for. They have something to share. It distracts their mind from some of the daily stresses that we all encounter. And all of those things play together to really give you something to share with other people. It gives you some activities to be social with other people, which is a big part of our community. And the other thing it does is I think it definitely raises your immune system. You know, by being energized, it creates you to be more hungry. And so with hunger, and being active, you're going to be pacing your meals at probably a better rate than someone that's snacking all day, depressed, probably eating foods that they shouldn't be eating that are not going to contribute to their general dental care.
Mm-hmm.
Okay.
So have you seen evidence of this in your patients there? That people have taken good care of themselves, have better dental?
Oh, absolutely. Here in Traverse City, the local community, some of the best, most honed athletes that I'm familiar with are in the 50-something crowd. As a matter of fact, there's a big bike race here in the Iceman, and one of the categories where the fastest riders are, they are the 50-plus crowd. I think a lot of these people have made a few bucks in their life. They've retired, maybe partially retired. They're out doing activities, you know, bike riding or kayaking, or they're hiking or whatever the case may be, and then they mix in some work and some play. They have a great attitude, and they enjoy social company. They enjoy, you know, being with other people and drinking wine and going to different events and food festivals and all those things. You know, yeah, it's not dental necessarily, but if you think about teeth, you don't want to lose your teeth because you're going to have a stigma about your appearance. You're going to have a stigma about your socio-economic scale. People look at you, if you were to have a missing front tooth, it definitely plays into our social environment of judging you. So there's all these things that these people that are active, they typically take care of their teeth. A lot of them want to bleach their teeth to give that appearance of health and well-being. And I see that a very, very big part of our population for my practice.
Okay. On the other extreme end, if someone didn't take care of their mouth, their teeth, their gums, so on and so forth, is it possible for someone to actually die from infections or bacteria? Or?
Oh, yes. Yeah. Again, usually with the particular group of patients I have, I don't see that many people that will come in with facial swelling or life-threatening emergencies. I have seen that on occasion. I definitely read about that in the literature about children, especially from third world countries, that there are children that die, not so much the older patients, I think that they seek care, but we'll see horrible dental infections where these people end up in the hospital with very grave situations, systemic infections, mostly extraordinary pain and difficulty getting some treatment. I think people don't realize that dental decay, not necessarily gum disease, but dental decay is the world's leading infection. I mean, it's considered a bacterial infection. And if you said, hey, there's cancer out there, there's heart attacks, there's diabetes, there's all these other issues, dental decay is the leading infection that's worldwide.
Is that so?
Absolutely, yeah.
So what are some of the real important do-nots? I mean, like probably chewing tobacco?
Absolutely, sure. Obviously the things that would probably not do you any good that we're all pretty well aware of, we shouldn't do. Chewing tobacco seems to be pretty popular amongst our middle-age adolescents getting into the 20-something. I don't see a lot of people that are older doing that, but it certainly can contribute to oral cancer. The nicotine and the toxins in the snuff are going to soak into the tissues of the mouth and raise havoc. They certainly deteriorate the enzymes that are good for you, and they also can cause squamous cell in particular. Smoking is obviously something that's not great for your lungs, but the carcinogens in the inhaled smoke certainly can contribute to oral problems, drying the tissue out, giving you bad breath, making the teeth sticky and attractive for other bacteria to adhere to. There's all kinds of problems with smoking. Excessive alcohol tends to be a diuretic. It dries your body out, it dries your mouth out. You'd think, well, alcohol kills bacteria. It does to a certain degree, but there's other problems associated with extreme social drinking. Some of the beverages that we drink, red wine's good for you as an antioxidant, but on the other hand, it tends to stain teeth if there's poor plaque control. But
so red wine can stain teeth. Has that been something you've seen more of then, since wine's become?
Absolutely. Yes. The teeth that are rough in texture or prone to decay, I will see for the red wine drinkers. It's extrinsic stain. It's not actually within the tooth structure, but it's usually pretty easily cleaned off. But if there's tartar, which is like dried cement on the outside of a tooth, it'll stain that very easily, and it can make the teeth partially unsightly. So coffee, tea, red wine, grape juice, some of those caramel colored beverages, a lot of the pops out there, those tend to have some of the discoloration of some of the stains, especially in the older 50-plus crowd. We have microfractures in the enamel. It's a crystal structure. It can percolate into it and can intrinsically change some of the color and a bit, but it's mostly extrinsic stain that's doing that.
Okay. Is there any over-the-counter toothpaste or whitening products that you recommend that people should look at? Or?
Well, I mean, speaking on behalf of myself, sure there are. It depends on what the goal is. There's products for every given situation, so it would be hard for me to identify all of them. I'll give you an example. If someone does have aggressive stain, baking soda toothpaste has been around since the 1920s. Paul Keyes was a periodontist. I think he was on the East Coast, and he created peroxide and baking soda mixed together as a dentifrice. And he was having his patients brush with that, and the peroxide released the oxygen, which was good for the tissue, and the baking soda was the abrasive. So that combination of kind of sand and oxygen really improved the quality of the staining, reduced the staining, and get the gums healthy as well. There's also fluoridated toothpaste. People that have a lot of root exposure, they will benefit from having those teeth bathed in a higher fluoride level that will harden the root structures, making them less prone to decay. Another example of a dentifrice, maybe someone says, I want a natural type toothpaste. Tom's of Maine has mostly natural ingredients, all natural ingredients if I recall, and it has different types of abrasives and soaps that emulsify the bacteria and will remove that. So I think toothpaste is probably the most common vein of what we understand as general people here in America, that if you brush your teeth, you're probably making some headway to keeping your teeth decent. I mean, that's the number one thing that everybody kind of buys into. There's an interesting study that shows that people that do floss, again, we know that the floss breaks up the bacteria in between the teeth, so you're cleansing the mouth of those particular pathogens. But there's also a correlation that people that tend to floss are more disciplined, more like maybe your elite athletes, and especially men that floss more regularly have a longer expected lifespan.
Is that so?
Yeah, it is so. And so again, we haven't. That was in one of the last studies I read. It's correlated. Again, is it the habit or is it the actual mechanism of flossing? Is it removing the pathogens and hence you're doing something physiologically? Or is it just that people that floss tend to do other things as well? Eat disciplined foods, exercise more regularly, watch their weight, see their doctor, for physical exams. I think that's probably the correlation there, is that they have probably other variables. It'd just be like someone that would ride a motorcycle. If you ride a motorcycle, your lifespan's probably going to be a little shorter than someone that doesn't ride a motorcycle because of the risk involved.
Okay. Any other tidbits or pieces of information you could throw at?
Well, sure. I think one of the things, dentistry is very exciting, and I think one of the things that we all look at is dentistry is kind of an interesting facet because we want a functional aspect. We want to keep our teeth healthy, but we also want to look good. You want to look good, feel good, and I think people that feel good about themselves typically are happier. And I see so much stress in the world right now, especially because of all the things that are happening in our society. There's so many odd things that are going on that concern me as a younger person. Now that I'm 50, I'm younger. But I think if you take care of your mouth, if you take care of your body, if you do everything in moderation, there's no reason that you can't live a decent life. I mean, I try to practice a little bit of what I preach. I mean, I try to eat reasonably well, but I'm not perfect. I try to exercise a bit, but I don't do it every day. But I think that I try to encourage to my patients that they should do some of those same things. But there's a tremendous amount of stress out there, and not that I'm a psychologist slash dentist, but if we can get a grip on the stress, I think our bodies will be healthier, and then I think that our teeth will follow suit with that, because I see a lot of people that really have some very difficult situations, and those are always difficult to overcome. And the last thing that you want to do is, if we're living to be much, if we're living longer than we ever expected before, I think the average lifespan was 72, now it's 78, I think. I see people well into their 80s and 90s. You are never too old to enjoy a good meal. You're never too old to socialize and visit with your family and friends. And the people that have the greatest difficulty are the people that are dental handicaps. They've lost their teeth, or they're struggling with their loose denture, and they're having a tough time eating their Thanksgiving meal with their family and digesting their food just because they have a dental problem. So if we can keep them from coming into that, and I think that's where I play in, is I've got an opportunity to kind of push people a little bit to not fall into bad habits.